Hello, Sloss Tech. How are y'all today? So glad to see y'all in this audience. You know, I did not know exactly what the turnout was going to be, but I am just so thrilled that we have people who are really interested in this conversation around corporate partnership and really what that means for the ecosystem and how we partner with startups. That's important, right? And so with me today, I have three individuals who are well versed in their own right in space with regards to health tech, patient care, healthcare, and they're all really focused on the same goal and have the same end in mind, which is really how do we take innovation and technology and be able to shape and close the gaps in this space. So I am joined today by, I'm going to start from right to left. I have Amy Rauworth, who is the Chief Research and Innovation Officer for Lakeshore Foundation. I am also joined by Melissa Mancini, she has a long title, y'all. She's the Associate Vice President of Strategy and Business Development and Associate Chief Innovation Officer for UAB Health Systems. And last but definitely not least, I am joined by the founder and CEO of Cerebro Neurotech Incorporated, Paolo Catilo. Would you all join me in welcoming them to this panel? I'm going to start off by, I have a quick caveat and disclaimer. I know the title here talks about best practices and corporate startups, but as I mentioned, we have UAB here, we have Lakeshore Foundation, and they're not necessarily a corporation, right? So we have healthcare, which is an institution, we have a nonprofit, but I think that regardless the rules, whether you're a corporation or whether you're an institution or whether you're a nonprofit, the rules, the benefits, the challenges, they're kind of all the same in a sense, right? And I'll say that when you think really about companies and what they're looking and aiming to do from an innovation perspective, what they want to do is it's twofold. You have efficiencies to be gained, right, in this innovation space, or you have resiliency. You got efficiencies from a standpoint of they're always trying to figure out process improvement, ways to do things differently. There are times where you have resources that no longer are the resources that you used to have, but the work remains the same. And then on the other end, you have companies they've been around long standing for a very long time, very astute in what it is that they do, and then boom, disruption occurs. So when that disruption occurs, they're trying to figure out how do they continue to advance their business in a way that makes sense into where they're going to be sustainable. And that's what we're going to talk a little bit about today. So, you may wonder, everybody up here is kind of in the healthcare realm in some shape or form, but not necessarily me. I lead innovation for the energy company. But, yes, we are focused on innovation for energy, but at the same time, one thing that we are really, and we pride ourselves, we have leaders in our organization, and I'm looking to see if anybody's out there, but, we're focused on our communities. We're focused on the customers that we support. And what's important to us is understanding the needs of those individuals. And then we want to be at the table as a corporate partner in figuring out ways to close those gaps. So that is really why I'm here today. And as you talk about healthcare, one of the biggest gaps is going to be in the healthcare space, right? So we need to do that in order to really sustain and continue to grow our economy in the state of Alabama. I will say, I'll throw a couple of facts out there just around this, right? So we talk about healthcare spend alone, right, in the U.S. was, I want to say it was north of close to $4.8 trillion, right? That is huge. And you think about in the state of Alabama, it was north of $30 billion. So these are issues, and this is why innovation is really going to be important for us. You think about patient care, affordability, accessibility, and those things are at the forefront. So I've talked enough. We're going to turn this over and really kind of get into it with our panel members who are here in support of all these efforts. Okay. So I'm going to start. First question, I'm going to give this to you, Melissa. I talked a little bit about efficiencies to be gained, resiliency. You work for one of the largest healthcare institutions, not only in the state of Alabama, but across the U.S., right? And so when we think about that, I want you to talk about what are some of the biggest challenges that you look to solve, and why is it so important that you specifically work with startup companies to try to find solutions to address needs that you all have?
All right, I'm going to go two-parter on this because it's a loaded one. Before I answer, though, I want to take a temperature check on the audience and say how many of you, and I'm trying to see with the light here, how many of you guys are actually affiliated with the healthcare ecosystem in some way, shape, or form? Okay, so a good bit of the room. So some of this may sound pretty familiar, but also feel free to challenge me afterwards if it doesn't sound on the mark. I would say that some of the things that we're looking to do are what I'm going to call the big three. And this is going to sound really, again, really familiar, really incumbent in terms of challenges. Quality, cost, and access. And when we're thinking about quality, I'm going to go ahead and define that a little bit more just so, to put it in context for our conversation today. When I think about quality, and when we're talking about that, it's traditional IOM definition, but it's right care, right place, right time, right? Three very simple concepts, but that are extremely difficult to implement on a day-to-day basis. When I'm talking about cost, it is cost for the entire ecosystem. As Tiffany was saying, that number that you threw out, that's 20% of our national GDP. So that's a lot of dollars being spent, and this is all the reason why we need innovation, is that we're seeing declines in what we are getting out of those dollars spent. And so, by reducing the cost within the ecosystem, we are reducing the cost to the payers, to the patients, and to everyone that is involved, which means we can do more and steward better what we have available to us. And then access. And I don't mean access just like, oh yeah, we have this service and so that means access, right? It's access in a culturally and socially competent way, in a way that our patients will receive the care and want to receive the care, right? So when you think about, I'm going to say those are the big three, and then I'm going to put a fourth one out there. And I was talking to somebody right before this, and it kind of affirmed what I wanted to say. And I want to say the fourth thing, and it's a little bit newer in terms of the dialogue. It's not new per se, but when I say it, you'll know. It's our workforce. Our workforce in healthcare is very much in crisis. We have massive provider shortages across the entire care team. Those aren't getting any better, and we're not going to be able to recruit our way out of that. We're not going to be able to train and recruit our way out of it, so how can we do it better? And then for those who are actually showing up to do the job, they're stressed. They are extremely stressed. Burnout rates just continue to tick up higher and higher. Mental health challenges they are increasing around the country. That does not exempt your provider and your healthcare workforce from being immune to that. So they are seeing that increased strain. And workplace violence, it's a sticky one. I was like, I don't know if I want to say it, but I think we need to talk about it. There has been a massive increase in workplace violence in healthcare, and a lot of times it's patient caregiver on staff and specifically on our nurses. And so if we're not paying attention to the people who are caring for you and your loved ones and all of our other patients, then we are really failing that entire ecosystem of the four things that I mentioned. And so my part B, and then I promise I'll pause for a moment. Why do we need to work with startups? Well, I just mentioned those are incumbent challenges, and we're not getting any better at it, right? So we keep turning to incumbent challenges, incumbent solutions, incremental improvement, and incremental improvement has its place, but it's an industry ripe for disruption across a number of things, and that's where startups can really help. It helps push the envelope. It helps infuse the energy. It's people asking the questions, offering solutions, and challenging the incumbency. And I think we as an industry, it's so valuable that we need to keep our eyes and ears and business opportunities open to those partnerships.
Well, I think what you said is spot on. And those are just some really big issues that we have to continue to tackle. And it sounds like, that's one of the things that you're very passionate about. But being a healthcare institution, that's so large and it's right. What are some of the challenges that you face as you try to engage with startups, both internal and external?
So big academic title, right, means big academic medical center bureaucracy. That's a UAB specific thing, but it's not a healthcare unspecific thing, right? I could sit up here and say, oh, it's highly regulated and the economic models are different than, if we were talking about economic models for energy or retail or other sectors. But the truth of the matter is, yes, those things are critically important. That's your personal data that's sitting out there. These are very personal interactions that we need to protect and steward. But there's also just a lot of layers and a lot of people that need to say yes along the way. And from an academic institution, that's probably one of the biggest challenges, is just peeling back the onion, finding those right champions. I was talking to somebody else before this, and I said, I can champion something all day long, but if I don't have a clinical partner or a clinical champion along with this, or an operational champion who's going to dig into the trenches with you and get it done every day, it's going to die on the vine. And so those are the things that I think we need to get more nimble about.
Wonderful, wonderful. Amy, I'm going to kick this over to you because, we talked about barriers with her, and I believe Lakeshore Foundation, with it not being as big, right? You all have done some amazing work. The Olympics, you've worked with some great partners, big partners, Nike, Apple, other wearable technology device companies, right? And you've done that well. Now you've transitioned, and although you've not in the past really dealt with startups, you're beginning to do that. And I believe Cerebro Neurotech is the first one that you've dealt with, right? So if you don't mind, would you kind of talk a little bit about, and I want to get this right, the launch of the Sports Science and Performance Center and the work that you're doing with Paolo and what drove you to do this work with him and his corporation, or his company?
Well, thank you. Thank you. Lakeshore Foundation is a local organization. We're a community-based organization. So we feel like we naturally fit between healthcare and research, and also advocacy being very, very important in that component. So we do activity, advocacy, and research, and have historically done that. But what makes us unique is in the fact that we can sometimes bridge the gap to the community and also create more access. So the Sports Science and Performance Center was a recent launch. We just launched in January. And I do have to give a shout out, 29 days until we see the Olympic opening ceremony. We are also having that. I invite you all to Lakeshore to watch that opening ceremony and then to send off our athletes to Paris for the Paralympics. So please come and support, and don't forget about Team USA. They're right here in your own backyard. So I think what's so unique about that is that equity still doesn't exist. So we understand that for a lot of athletes with disabilities and just in general health promotion and preventative care, we know that people with disabilities experience greater disparities than all the rest of the population. In the U.S., it's 61 million Americans with a disability. Globally, that's about 1 billion. That's 1 in 4. And so I think what's really profound in this community, in the tech, in the startup, and in healthcare is that if you aren't designing your services, your technology, whatever you're creating to be universally designed and to be inclusive of older adults and people with disabilities, you're missing a very large target audience. And one of the most unique things that we're doing with the Sports Science and Performance Center is we're translating that research. We're getting athletes to their peak performance. And that's a really important, essential ingredient for us to not only win gold, but also for us to create longevity opportunities for people with disabilities as they age. And so it is that full continuum. And with Paolo, I think what was so unique is that he wanted to be inclusive from the start, from the get-go. He reached out to us and said, we have this great new device, and I want to make sure that Celine, right? Celine understands his AI model, understands people with disabilities and with different cognitive and neurological components, and that his technology works for our targeted population. We know that the Paralympic movement is growing and growing. There's more sports, more athletes that are involved. A lot of them come through Birmingham on their way to representing Team USA. So that's really profound as well. And for those athletes to have that opportunity to prevent concussions or to identify concussions is really, really important. They're often underrepresented, and it also is compounding. If an athlete also has some type of traumatic brain injury or neurological issue that has affected their brain, that TBI, that concussion, compounds and compounds on itself. So sometimes those issues can extend, and they can end an athlete's career. So I think the really, really unique component is that Paolo was like, how do we make this work? I was like, sure, okay, let's figure this out. Let's figure out how we can ensure that your technology that we believe is so needed, not only in the Paralympic movement, but in general, in any sport. We've all had kids. My kids have had concussions. One of mine, I was like, you're not gonna go back out on that field. Your brain is super important. So lacrosse is fun, but until they start to wear helmets, you're not gonna go back out there if you get another concussion. So it's something that affects all of us. And I think, Paolo's openness to universal design, to acknowledging the disability community, and that was something that was very profound when we worked with Apple, is that they acknowledged that the disability community was a target audience. When we worked with them to create the access for the Apple Watch, they were identifying our users as a segment of the population that they wanted to reach. And that was profound then, and it is now still. So for all of you that are creating technology, that are founders, that are creatives in this space, I think that is the pathway to follow for success.
Awesome. So following that, along the lines of that, Amy talked about, Paolo, that you were the one that sought her out, right? So in thinking about this, I think that the partnership between an entity and a startup or a founder, it has to be a two-way street, right? It's not just about a yes on the entity side. It's not just about a yes on your side, which I think founders would love for the yeses to come, right? But I think that there's some things that are viable in you determining like what entities are best suited for you. So would you let us peek under the hood a little bit and talk about that process and what you look for in companies that you work with.
Sure. Excellent question. Actually, if you guys just give me 1 second and give me some grace. I'm 42 years old and my family still doesn't know what I do. So if just say hi. Because mom knows that I'm fixing computers at a hospital. Right? Do a little bit more than that. But from your question, Tiffany, what's happening in what I've witnessed in Birmingham, specifically in this ecosystem, since I stepped foot from Washington D.C. I have family in New York and Washington D.C. I fly into the airports on March 5th. No, actually, Kelly. If Kelly's around here, she calls me up, says, "Paolo, we have a program going on here called Prosper Health Tech." That was March 5th, and I said, "Where is it at?" She said, "Birmingham." I said, "Where's that?" Right? I didn't know it, but either way, I think maybe 30 days later, I find myself going to the Spot. This kind of, what is that place called? It looks like a country club, but there's no golf course. The club. Yes. I said, I looked around. I said, what did I get myself into? Right? And I walk in this huge room. Everyone has a blazer, but me. I was like, wow. All right, let's keep it going. That's where I was actually introduced to Maria Underwood at BHAM. BHAM Bound, and you guys are so nice because I've been saying BAM for the longest time. No one has corrected me. I said BAM Media or BAM this. Anyway, I just found out today. I've been here 3 months.
Birmingham Bound. That's what it stands for. BHAM. Birmingham. So
I was chatting with Maria, and she was telling me, you got to meet this person, right? XYZ. I said, oh, all right, that sounds good. I'm already welcomed. I was happy that I was able to articulate what my company was doing in a very short period of time where it's a very loud, very big crowd, right? So she says, I need to meet this organization called Lakeshore Foundation. And I said in my head, that sounds pretty big. All right. I don't know anything about them just yet. So I went home after this dinner, and I actually talked to my AI and got as much data as I could. Soon after, I landed a meeting with Amy about 10 days later, actually. So just where this is going is that from March 5th to May 30th was 82 days of just landing in Alabama, Birmingham, and closing this partnership with this amazing entity that believes in the same mission that we're doing as well. Like that shows, you can't replicate that anywhere else. I've been to other cities, right? And so that's the kind of pathway that made this kind of more magical. And we're not even talking about once we started talking, Amy, like we just had a conversation. It felt like we've known each other, right? Because we're on the same trajectory of that mission. So when I'm looking for these partnerships, obviously the first thing is what patient outcomes, obviously, right? But does this feel good? Does this feel good together? And I'm just so happy my little company is in the ranks of the research with folks like Nike and Apple. That speaks volumes to me. Thank you so much, Amy.
Thank you, Paolo.
Cool. Well, very good. Very good. So y'all are in this clap. You can clap for me. So y'all are in this partnership together now, and either one of you all can answer this. But, you think about what success looks like, and sometimes you hear stories around founders or just companies working together and things not going according to plan, right? So what measures really did you all put together up front to ensure that everybody is being held accountable for doing what they said they were going to do in this agreement? Tell us a little bit about that.
I can start, Paolo.
Please.
Yeah. And then, so we do our work in and among other groups that are really trying to solve similar problems, trying to create more access. And so we do a lot of strategic partnerships, and some work and some don't. Some organizations are on a continuum of inclusion and they're about checking the box. And we kind of know that's probably not where we want to be. We have limited resources. We're nonprofiters. There's ands in our title, and we just do everything that's asked of us, and happily do that for the mission and with the passion that we have for what we do. But I think, clarity is kindness, and putting down those expectations of what we can do realistically and what the partner is going to do, and then we agree to evaluation. So that's how we do all of our partnerships, whether they're a national organization that's creating grassroots sports for youth in underserved communities, or whether it's Paolo and Cerebral Neurotech. So it's about agreeing upon what you can do and what you want to do, how we're like-minded, what is the outcome and goal that we can partner on, and then agreeing that we're going to evaluate this, because sometimes things work and sometimes they don't. And so by the end of the 12 months, we can openly say, hey, we gave it a shot. Or, wow, this was like so much more successful than we thought it could have been. And now look where we're at. So I think that is being very clear with expectations and agreeing to evaluate those expectations and the outcomes that you get to.
So, Amy, here's a question I want to ask for you, right? So you mentioned that
Great. Paolo has a lot of questions.
Lakeshore Foundation doesn't usually partner with startups, right? And so you work with these behemoths like obviously Apple and Nike. Here comes my little company. We just have a big, audacious concept. Right, I haven't even showed you the product, that instance, just yet. What was it that kind of stood out about why this little company was you had to pay attention to?
I think your passion met our passion. So that level of trying to solve a problem that really needs to be solved, doing the right thing because it's the right thing to do, not because it's the easiest and not because it's the faster path. But I think that was really what spoke to me. And then the fact that I heard the panel ask the other day, what's the next latest and greatest? And sometimes you can't get to the moonshots because you have to solve the problem right in front of your face. And so we know that identifying concussions is a major thing, and it's a big problem. And so much of the research right now, and Lakeshore is funding some of that research. I would say we just put out an RFP, and probably of the applications, a quarter of them were around concussion research for Paralympic and disabled athletes. So this is a hot topic, and if you can do what you say you can do, and we can help you do that, and even if we have some bumps in the road along the way, we're benefiting the movement greatly. So I think the like-mindedness, the passion, the openness to take the harder path, even just because it was the right path.
Yeah, I appreciate you saying that there will be bumpy rides, because You could always set out a plan, but we know there's one truth about that plan is that it's not going to happen that way, right? So I think that I don't want to say culture, but that alignment of our missions are so strong and so in line. We're just compelled to make this work, even if it's just a concept at this stage, right? We're going to make this work, and I've already tested it a lot internally. I know it's going to work. So we're excited about being this, AI software as a medical device company, but we're focused on making our developments, our innovations more representative, and that comes with training data, different pockets of demographics, ages. Like, we want to make the AI that's training data that goes in is amazing on its way out. Otherwise, you're not going anywhere with those algorithms, right? So those missions have to align for us. And it sounds like it's going to go. We're going to do some awesome things.
We're going to do it.
Yeah.
I love it. I love it. This is just a testament to Birmingham, right? So you think about the size city that we are and the networks and the connections where we love to say we're 1 degree removed from knowing anybody, right? And just to hear how quickly this relationship evolved, I mean, it should give every founder in the room, and I'm not saying it's perfect, we got ways to go. But I think that this should give us hope, right? This gives us hope. And so I want to stay close to this relationship, this partnership, just exactly how it transpires moving forward. I know we are almost there with time, but I have one question that I just got to get out for whomever decides to answer this. All three, y'all may say, I don't want it. Nobody answers this, right? But where do we see innovation headed with regards to healthcare in the next 5 to 10 years?
Nobody's talking, so I'm going to talk. So I don't know this, but it would be really easy for you to want to, or for me to say, you know what? In the next 5 to 10 years, it's going to be AI, right? That would make Paolo very happy, or extended reality, or an infusion of digital health. And I think there's probably several founders or others in the room that would love to hear that prediction. Could be, but I would like to be a little bit provocative because I'm known for that in my work appropriately. Right. So, and say it's not about finding the new and shiny thing and then working backwards into solving a problem. It's about listening to the problems that are all around in whatever sector and industry that you're in, diving deep and solving for that. And then that's going to get you traction. And I think you hear that from the passion that Paolo displays and the passion that Amy is displaying about this partnership, right? You said it. It's solving a problem for us. It's critical for us, and that's why this works. It could have been an extended reality and an AI solution. It could have been something else, but didn't matter because it was solving the problem. And so I think that's where I think innovation sometimes can fail as a discipline, is we get too focused on chasing the next shiny object or the next thing on the Gartner curve, right? And we need to remember to go back to basics and deeply listen to your customers, to your patients, and to everything that's around you. So that's my answer.
Yeah, I would say person-centered. Anything that you do, if you're trying to solve a problem, ask the community, engage. If you're not part of the community, I would ask you to pause for a moment and try to understand what solution or why you're doing that. But I would say centering the person, human-centered design is so important. And regardless of what it is, whether it's a new process, it's a technology. And I also think, there are a lot of laws out there that are going to require technology to be accessible and inclusive. We have policy, we can enforce that policy, but we really need people to embrace it and to just not want to discriminate and to want to create access and inclusion, and also to understand it's just better for your business. So I would say maintaining inclusion in all digital components that includes for the disability community, and working with the disability community. So you may have a solution that will help a disabled athlete, but the really important issue is that it's with and not for.
Love it. Love it. Anything to add?
No further questions.
All right. Look, that's on that note, mic drop, right? Well, I just want to thank you all for your time, your expertise in this space. I mean, I truly got something out of it. I hope that you all got something out of this as well. Thank you all for showing up, listening to us today.